Welcome back to Vital Signs. I'm Jen Gaudet here with Jeery Fu, who is a pharmacist and also a coach. We stopped before the break talking about a little bit about pharmaceuticals. All of the pills that we put into our body have an unintended consequence. Well, now let's dive into what everybody's talking about, weight loss drugs. Jeery, weight loss drugs are on everybody's mind. People are wanting to pop a pill to drop pounds, and they're seeing these negative consequences, or maybe they are less informed. What do we need to know about the weight loss drugs that are out there today?
Yeah, one of the recurring sayings that I've used for myself and for others is to remember that external solutions don't necessarily fix internal problems. They are supplements. Much like most medications, they are meant to kind of help you in a secondary motion along the way to get you to the life quality that you're looking for. And so a lot of people, the irony is that a lot of people get mad when they tell us, hey, our medication didn't arrive yet, and we've never had a problem with noncompliance with weight loss medications. Like it is alarmingly good problem to have. And so the irony is that when people want too much of a good thing, like when people are losing weight more quickly than they should, that leads to more problems. It doesn't solve they think that they can finally coast, they can eat what they want, they can live a little more irresponsibly, and unfortunately that's just not the case. We've seen dentists who have even, tried to ride this wave of saying, oh, well, let me fix your teeth and I'll help you lose weight, which will, somewhat help your dental care maybe. And so people need to remember that it is a long game. As much as we love to see short-term returns and we love hearing that strike when we knock down all the pins at the bowling alley, right? This is the doctors and the practitioners that have the most integrity understand that this weight loss medication is a supplemental measure to a much bigger picture of holistic wellness, as we've talked about, because the best ones, or the most competent ones, the most trustworthy ones, will understand, hey, let's put you on your regimen, let's make sure your diet is maxed out in terms of nutrition, let's make sure you're on an exercise regimen that's appropriate for your age stage of life, and they understand, hey, we'd rather have gradual, incremental, permanent change as opposed to the quick microwave weight loss that says, okay, now I can be more irresponsible, because I think that's what people secretly want to be able to do. So that's what we see, and we have people that complain, or they they drew up too much medication, or they said, well, if I lost 5 pounds when I took this much, imagine how much it could lose when I take double the dose. And they said, well, did any prescriber endorse that move, right? There's a lot. This is where self-directed medications and self-directed leadership can sometimes go off the rails, right?
Well, and there's dangers to that, right? I would love for you to dive into what are the dangers of us randomly upping our medication, because it's something that is not talked about very frequently, and it's not something that they talk about because traditionally, non-compliance with medication is the problem. So you're fighting to get them to take the prescribed medication for whatever diagnosis. However, you're seeing the reverse, and people are just upping their dosage with weight loss drugs, for example. So what are the dangers there? Like, what are the things that the population needs to know? Because listen, folks, this is not medical advice. This is education, and you must talk to your healthcare providers before you change anything in your healthcare routine, including increasing the dosage of your medicine. But we have a pharmacist here who's really well versed. So talk to us about some of the dangers of us tweaking with the dosages without consultation of our practitioner.
Yeah, as much as I love WebMD as a supplemental resource, it's no substitute for a medical degree, as much as there's people see MD in the name. And the simple answer is that when you increase the dose, you increase the chance of side effects and toxicity. Every medication to your body, every medication is a toxin that needs to be metabolized and excreted before it causes any permanent damage. And so it's the cleverness of the industry is that we design a medication that can bypass the body's defenses to actually do good work. But like I said, there's too much of a good thing. With every dose, we are extremely conservative when we say, hey, start low, go slow. Why use any more than you have to? Because we don't want things like pancreatitis. We don't, where your pancreas starts to malfunction or act up. There's people that get nausea and vomiting because they try to get to results too quickly. Headache is another common side effect. And so if you're wanting to lose weight, but then the side effects are overtaking your ability to even, enjoy your new weight-free life. Like, what's the point of that? And again, we are here to make sure we understand, we appreciate the fact that you are motivated to take this medication so that you can enjoy life a little more fully. And at the same time, we're going to preach patience every single time. Patience for patience, right?
Yes, right. Patience for your changes.
Yes.
And you just mentioned toxicity, and detox is another buzzword.
Yes.
What are your thoughts as a pharmacist in this space? Because there's a whole lot of information and, quite frankly, misinformation out there about detox. And we've talked about detox on this show. Our bodies are made to naturally detoxify us. And if we're on a medication, it's meant to go through certain processes. Talk to me a little bit about that. Like, what are the things that we need to know from your perspective?
Yeah, when it comes to detoxing, it comes back down to, what do I know that my body can synthesize on its own? What do I need to supplement it by eating in my diet to make sure that I actually have a complete supply of resources that's continually going through my body to continually optimize its functions, knowing that there's no shortage of nutrients or enzymes or anything else like that. And so part of this, again, too much of a good thing. People think, oh, well, if this dose of vitamin is going to help me, maybe let me double it. And again, it's just, I appreciate it. I used to think like that. And I thought, well, if this much is good, think about doubling, that must be better. And it's not always the case. There's a certain dosing range for every, any supplement or medication that's out there. And so giving your body, also treating it well and letting it recover, giving it time to kind of normalize its functions and continually making those adjustments. It's kind of like a steering wheel, right? When you're driving, when you go too far one way and then you make the mistake of overcorrecting, and then you can't even get into a straight line again. And so this is the kind of analogy that we're trying to get people to understand with medication, supplements, things like this. And hey, sometimes you just have to do maintenance, let things wash out, reset, and see where the default is, and then you can make slow and gradual adjustments so that your body is optimized.
And let's be real, folks. Like, what is the right dosage of any supplement, vitamin, mineral, pharmaceutical for me is different than for you. We have different gender, we have different sizes, we have different body composition, and so all of these things play in. So just because it worked for mom doesn't necessarily mean it's going to work for me. Can you speak a little bit to that and individual? Because one of the things that we're seeing in the overall community is, oh, well, sister takes this and mom takes this and dad does this, so then I can take this too. Like, talk to us about what we need to know about that.
Yeah. There's an interesting, almost transferable benefit that we want to say, well, what's the saying? What's good for the goose must be good for the gander. And this is one of those things to say, hey, I remember when my parents went through a glucosamine phase and they just realized, like, oh, this is the supplement I need for joint health. Sure, why not? And I'm not refuting the idea that sometimes if traditional medicine isn't getting you the quality of life you want, because it is. Physicians are human too, and they can only diagnose so much. And I'm willing to say on record, yeah, if it's a supplement, sure, try it once, see how you respond. At the same time, be vigilant over if it's actually helping you, improving you, because you may have to make the necessary choice to, stop a supplement or reduce its dose, and that's okay, because if you're ignoring your body's feedback when you're responding to something, when you start taking something new like valerian root or some of these other supplements like ginseng or garlic, and you're just saying, well, I just need to keep taking more, and even if my body's like saying maybe you need to stop, and you're like, no, I think I know what's best for you. There's the head heart thing just kind of doesn't line up sometimes. So I always tell people, yeah, if you see benefits from other people, sure, we're all human on some level. There is some shared benefit, and at the same time, yeah, tailor that, because you are not your mom. There are some similarities, obviously, but what your circumstances are different than hers.
Absolutely. Thank you so much for that. And I think it's really important that we listen to that, folks at home. Just because someone else has a result doesn't mean that that's going to work for our body. We all have different allergies. We all have different food tolerances. We all have different laboratory results. So make sure you look at this and approach your practitioners and find out what's necessary, and even with supplementation, one of the things that I always think about, I do take supplements, but I check my blood work regularly, and I have a practitioner who helps me to say, okay, great, well, we're in range here, here, here's where we need to do. And so it's never I'm going to take a supplement, I'm always going to take a supplement every day for the rest of my life. It's what do I need because I'm not getting it in my diet because I'm traveling or whatever. And then we are always tweaking that because I want to be a peak performing human being. So just because you're reading stuff on the web or you're seeing stuff or hearing stuff doesn't mean that it's necessarily going to work for you. That's why we always advocate for checking with your practitioners so that you know what's right for you. And you know what? I really like that you said we're all individual. Our bodies are our lab. Like we're a unique lab.
Yes.
And it's really good to test one thing at a time instead of test a lot of things, because if we do that, we don't know what caused a reaction if we have one. So thank you for that, Jeery. If people would like to learn more about what you're doing here in Houston with your pharmacy, how can they reach out to you?
Yeah. On the pharmacy side, our pharmacy is called South End Pharmacy. The website is southendpharmacystore.com. And we even have a YouTube channel where we provide educational webinars on the newest trends in weight loss, especially with the FDA regulations coming out, because a lot of people are scared in the next couple of weeks that some of these drugs might not be as available or accessible as they used to be. And so southendpharmacystore.com, not southendpharmacy.com. There's another same name pharmacy in South Carolina, and we get mixed up all the time, so we had to choose a different domain name. But yes, southendpharmacystore.com, and check us out on YouTube. Happy to make sure that you are up to speed on the latest health and weight loss trends.
Absolutely. Thank you so much for that. Stick around. We'll be right back after these messages.